Huntington's disease. Imagine a condition where your body starts moving uncontrollably, almost like you're dancing involuntarily. That's Huntington's disease. It's sometimes even called Woody Guthrie's disease, after the American folk singer who had it. It is a progressive neurological disorder characterized by uncontrolled movements, mental deterioration, and changes in behavior and personality. It is caused by a genetic mutation that leads to the degeneration of nerve cells in the brain. Symptoms include dystonia, chorea, slowed movements, speech and swallowing difficulties, weakness, rigidity, and personality changes like depression, irritability, and impulsiveness. Schizophrenia, a chronic mental disorder characterized by disturbances in thinking, perception, emotions, and behavior. Its exact cause is unknown, but likely involves a combination of genetic, environmental, and brain chemistry factors. Symptoms include hallucinations, delusions, disorganized thinking and speech, reduced motivation, social withdrawal, and impaired cognitive function. The prevalence of schizophrenia is thought to be about 1% of the population around the world. It is thus more common than diabetes, Alzheimer's disease, or multiple sclerosis. Crohn's disease, a type of inflammatory bowel disease that causes inflammation in the digestive tract. Its exact cause is unknown, but factors like genetics, immune system problems, and environmental triggers may play a role. Crohn's disease signs include abdominal pain, diarrhea, fatigue, weight loss, and sometimes rectal bleeding. Amyotrophic lateral sclerosis, ALS, a disease that breaks down tissues in the nervous system of unknown cause that affects the nerves responsible for movement. It is also known as motor neuron disease and Lou Gehrig's disease. It is fatal within 3 years for 50% of all people affected, and within 5 years for 80%. 10% of people with ALS live beyond 8 years. Common symptoms of ALS include muscle weakness, muscle twitching, difficulty with speech and swallowing, muscle cramps, and eventual paralysis. Fibromyalgia, a chronic disorder that causes pain and tenderness throughout the body, as well as fatigue and trouble sleeping. Scientists do not fully understand what causes it, but people with the disorder have a heightened sensitivity to pain. Chronic obstructive pulmonary disease, COPD, a long-term lung condition that makes it hard to breathe. It's usually caused by smoking, but exposure to air pollutants or genetic factors can also contribute. Signs include shortness of breath, coughing, wheezing, and chest tightness. Multiple sclerosis, MS, a chronic autoimmune disorder affecting movement, sensation, and bodily functions due to destruction of the myelin insulation covering nerve fibers in the central nervous system. Genetic factors may increase the risk. Symptoms include fatigue, difficulty walking, vision problems, bladder control issues, numbness or tingling, muscle stiffness, balance problems, and cognitive impairments. Kuru disease. Imagine a mysterious illness that steals away the mind, leaving behind only laughter and trembling. That's Kuru disease, a rare and always fatal brain illness linked to a chilling practice of cannibalism in New Guinea. It's caused by an infectious prion found in contaminated human brain tissue. Symptoms start with arm and leg pain, but soon progress to severe coordination problems, difficulty walking, headaches, and swallowing issues. As the disease takes hold, uncontrollable laughter and muscle twitching become prominent, eventually leading to dementia and malnutrition. Lupus, an autoimmune disease where the immune system attacks healthy tissues in the body. Its exact cause is unclear, but factors like genetics, hormones, and environmental triggers may contribute. Symptoms vary widely but can include fatigue, joint pain, skin rashes, fever, and organ inflammation. Muscular dystrophy, a group of genetic disorders characterized by progressive muscle weakness and degeneration due to genetic defects in muscle proteins. Symptoms include difficulty walking, using arms, muscle and tendon shortening, breathing issues, curved spine, heart problems, and swallowing difficulties. While there's no cure for muscular dystrophy, treatments like physical therapy, assistive devices, and medications can enhance quality of life and symptom management. HIV/AIDS, a serious illness caused by a virus called HIV. HIV attacks the body's immune system, making it weaker and unable to fight off infections and diseases. Without treatment, HIV can lead to AIDS. It spreads through sexual contact, pregnancy, and exposure to contaminated blood. It weakens the immune system, leading to AIDS, which affects major organ systems. Early HIV infection may have no symptoms or flu-like symptoms. As it progresses, symptoms like swollen lymph nodes, weight loss, diarrhea, cough, and fever may appear. CDC states that once people receive an AIDS diagnosis, they typically live for 3 years. Cystic fibrosis affects the body's ability to move salt and water in and out of cells. This defect causes the lungs and pancreas to secrete thick mucus, blocking passageways and preventing proper function. Cystic fibrosis is a genetic disease. It is caused by a defect in the person's genes. Nearly 40,000 individuals in the U.S. live with cystic fibrosis, with around 1,000 new cases diagnosed annually, and over 75% are diagnosed by age 2. You may experience signs include shortness of breath, wheezing, chronic sinus infections, salty-tasting skin, and clubbing of fingers and toes. Alzheimer's disease. Alzheimer's disease is a progressive neurological disorder that affects memory, thinking, and behavior. It is the most common cause of dementia and typically occurs in older adults, gradually leading to a decline in cognitive function and ability to perform daily tasks, lasting at least 6 months and not present from birth. Epilepsy. A neurological disorder characterized by recurrent seizures, which are sudden and uncontrolled electrical disturbances in the brain. These seizures can vary widely in severity, frequency, and symptoms, and may affect consciousness, movement, sensation, or behavior. The cause of 50 to 70% of epilepsy cases is unknown, while others may result from birth trauma, including oxygen deprivation, head injury, bleeding, blood incompatibility, or infection around birth. About 3.4 million people in the U.S. have epilepsy, including 3 million adults and 470,000 children, with approximately 0.6% of children aged 0 to 17 affected. End-stage renal disease, ESRD, a condition where the kidneys stop working completely. It can happen due to long-term kidney damage from conditions like diabetes or high blood pressure, or from kidney infections or diseases. Indications include feeling tired, swollen ankles or feet, trouble sleeping, itching, and difficulty breathing. Treatment options include dialysis or kidney transplant. Interstitial cystitis, a chronic bladder condition characterized by bladder pain, urinary urgency, and frequent urination with no known etiology or treatment. Its exact cause is unknown, but it may involve issues with the bladder lining, an abnormal immune response, or nerve dysfunction. Myasthenia gravis, an autoimmune disorder that causes muscle weakness and fatigue due to a breakdown in communication between nerves and muscles. It occurs when the immune system mistakenly attacks receptors on muscle cells that receive signals from nerve cells. Pink Panther star David Niven lived with myasthenia gravis. Symptoms include muscle weakness, drooping eyelids, double vision, difficulty speaking, chewing, swallowing and breathing, and fatigue. Sickle cell anemia, a genetic blood disorder where red blood cells become rigid and crescent-shaped, causing blockages in blood vessels and reducing oxygen flow to tissues. It's caused by a mutation in the gene responsible for producing hemoglobin, the protein in red blood cells that carries oxygen. Sickle cell anemia symptoms include fatigue, pain, jaundice, delayed growth, and increased susceptibility to infections. Parkinson's disease is a neurological disorder that affects movement. It occurs when certain nerve cells in the brain, which produce a chemical called dopamine, become damaged or die. This leads to symptoms such as tremors, stiffness in muscles, slow movement, and impaired balance and coordination. Its symptoms are seen in up to 15% of those ages 65 to 74, and almost 30% of those ages 75 to 84. Osteogenesis imperfecta, OI, a genetic disorder characterized by brittle bones that break easily, often with little or no apparent cause. It is caused by mutations in genes responsible for producing collagen, a protein that helps build bone strength. Warning signs include frequent bone fractures, short stature, weak muscles, joint laxity, and hearing loss.